Over the years, he's done dosing studies as well. So we looked into a very commonly prescribed medication called Cialis. We're trying to think that if we could improve blood flow, we might be able to keep the muscle healthier longer. So he was in a dose ranging study for that, for Cialis and Viagra. We were looking at both products. And that was very burdensome to him. It was a lot of blood work. It was almost all PK values. And there was also some very strange functional testing where they put boys in a vacuum pressure tank. And I mean, some of the stuff was pretty, I don't want to say wackadoodle, but it was definitely different. And just trying to think about what kinds of classes of drugs are going to help this disease. That trial was really difficult because he participated in about 2 years worth of dose ranging studies, and then he lost ambulation and could not participate in the trial. It's extremely disruptive. These kids they already feel different. They're already moving differently than their friends. So they already feel, a lot of Duchenne boys struggle socially. So, because they're different, and then they're missing so much school because they're constantly in these trials. For that one, we lived in Orange County, California at the time, but we'd have to take 2 days off because they wanted to see him over 2 days so they could, get all the blood and evaluate it while he's still there on site. So that was 2 lost days. I think we were in that for 2 years. So he was missing 2 days of school every 6 months. And it was a lot. And kids don't like to be poked with needles. And that one was honestly traumatic for him. I'm kind of surprised he doesn't have a fear of needles. He's kind of a champ with all the different, he has to have a cardiac MRI every year, and that's used with contrast. I mean, they are lots of blood work involved with Duchenne, but it was extremely disruptive. I think it makes a huge difference, and I think it's becoming increasingly important because as we get more and more trials going, people are getting more selective. We have several options now, which is such an amazing thing for me to be able to say, that we have many options. When people get this diagnosis now, hopefully their doctors are saying, you got 5 trials that you could think about. And options for home visits are part of a trial. I think that's a definite incentive to participate. You've eliminated half of the hassle. Well, probably more than half. You don't have to miss school. You don't have to travel. You don't have to miss work. You don't have to have a huge disruption. It's like a kid might be late for school. Some of the kids that were in our early exon skipping trials were going to one site in the whole country. And people were climbing all over each other to get into this trial because we didn't have any trials. So everybody wanted to get in the trial, but they only selected 13 patients, and those 13 families were flying to Columbus, Ohio once a week. These kids would miss 2 days of school, fly to Columbus, Ohio, get their drug, go home. And that was crazy to me. We've had many instances, it's a rare disease, so clinical trials aren't available, at every hospital or every clinical research center. You have to travel for them. And those, but when you're thinking about functional assessments and blood work, you have to be on site for at least 2 days for the most part. So yeah, these kids are missing a lot of family activities and school activities.